welcome to this presentation of cognitive behavioral therapy and group counseling. This presentation was created by myself, Michelle, and Anthony, and I will be sharing it on behalf of both of us today. So let's jump right into it. So first off, let's talk about the basics of CBT. So CBT is founded on what is often referred to as the CBT triad or the CBT triangle, which is this idea that we have thoughts in regards to an event or an incident or something that occurs in our life. We have automatic thoughts about it, and those thoughts inform and influence our emotions, and then our emotions inform and influence our behaviors. And it is not just a linear experience of these things. All three of these things, thoughts, emotions, and behaviors, can influence one another. But primarily, it identifies that when we have negative thoughts about something, it can cause us to have maladaptive or unwanted behaviors. So with that being said, obviously the goal of CBT is to empower clients to change their thought patterns and in turn change their feelings and their behaviors, which can, as we know, change someone's life dramatically. So before we hop into anything more complicated, let's talk about some important terms when we're discussing CBT. So first off, we have mindfulness. Of course, many of us probably have heard of this and understand what it is. But essentially, it's just the idea that, we want to be fully present in each moment and put all our attention into what's in front of us. And this technique can help us kind of manage our emotions and regulate ourselves better. So then we have skill training, and this is exactly what it sounds like. Basically, it's just teaching coping techniques and ways that we can work through the problems that face us on a daily basis. Then we have cognitive distortions, and these are these negative thought patterns that are crucial to the idea of CBT. So any sort of irrational or distorted thinking that results in any type of distress, and that could be distressing emotions, distressing behaviors. And then there are tons of examples. I think probably the most common that we hear about is catastrophizing, black and white thinking, and then overgeneralizing. And of course, there are many, many, many more. Then we have cognitive restructuring. And this is basically the process of taking those cognitive distortions and evaluating them and kind of reframing the way we think so that our emotions and our behaviors are more aligned with logic, per se. So basically just restructuring the way that we're thinking so that we behave in healthier ways. And then on this next page here, we have relapse and relapse prevention. So obviously, most of us are going to understand what this is already, but in the context of CBT, typically this is going to look like sort of that psychoeducation piece of teaching clients skills that they can go on to use independently when their therapy experience is over. And, just making sure that they are effective in using those skills in order to prevent relapse. And then these next three are going to be three basic principles of CBT, the first of which being Socratic questioning. So this is just the process of asking open-ended questions to allow your client or clients to kind of have these deeper thoughts and sort of explore their own perceptions and their own thought patterns and things like that. Collaborative empiricism refers to the process of the therapist and the client coming together to determine things like treatment goals and how those goals are going to be achieved. And essentially, the idea is to give power to the client and make sure that they feel that they are a part of a big part of their own growth process. And guided discovery, which is the last one, is basically where the therapist kind of encourages and guides the client in using new information to be aware of their own thinking errors and, how to reconstruct them. So in a way, it's kind of like scaffolding almost. So, the therapist doesn't want to come out and directly say, you're engaging in a cognitive distortion, but they are going to approach it in a more tactful way so that, once again, the power is primarily with the client. So moving into the process of CBT, this is going to start with the therapist understanding what the main concern is. So the therapist needs to get a holistic understanding of the client, and this includes the client's cognitive schemas. So cognitive schemas are cognitive frameworks that help us organize and interpret information. And these can include things such as our view of ourselves. It can be something like a stereotype. An example that I like to use is I work at a zoo. And a lot of times I hear children go up to the lion habitat and look at the lions and say, look, a tiger. And the parents are always like, no, that's a lion. So the child probably has it in their head that, a tiger is an animal that looks like a large cat and it has 4 legs and sharp teeth and XYZ. And that's how I know it's a tiger. But when the parent comes and says, no, that's a lion, then it's the child starts to process this new information and that schema starts to adapt. So now the child knows that's a lion, not a tiger. And that's a very juvenile example of cognitive schema. But I think it kind of helps us to understand how they operate. Within the process of CBT, the therapist is also going to help the client in identifying negative thought patterns. And this is sometimes referred to as ANTs, which is automatic negative thoughts. And it's also sometimes referred to as cognitive distortions. I feel like all of those things are somewhat interchangeable. But the therapist is going to help the client identify that. And particularly in a group setting, even other members can help each other identify cognitive distortions like that. Of course, that's going to depend on the group dynamic. The group dynamic needs to be healthy enough so that constructive criticism can be made from group member to group member. And then the next thing the therapist is going to do is help the client in restructuring the negative thoughts that they are having. So being able to challenge your clients and, use that sort of guided discovery to help them realize they are engaging in a cognitive distortion and then also aiding them in restructuring. So this can look like decatastrophizing or reattributing or any other sort of CBT technique that involves reframing those thoughts. And then, of course, there's also this component of behavioral intervention within CBT. So this could look like a lot of things. I have seen it, the most common way I have seen it is that the client is encouraged to use coping skills in everyday settings. And it's a sort of like exposure therapy. I know for myself, my therapist had challenged me once to go shopping at Walmart on a Saturday afternoon because he knew that it gave me anxiety. And he wanted me to put my coping skills into practice. And of course, a therapist can never force you to do this, but they can encourage you. And if it's something that you're okay with and that you consent to, obviously, as a client, you can make the decision whether you want to do it or not. But I think, sort of encouraging this helps a client put these skills into practice and work on changing those unwanted behaviors. And then the next component we have here, I think, is arguably the biggest piece of CBT, and that is going to be this psychoeducation piece. So obviously, in order for the client to be able to independently recognize and then reconstruct negative thought patterns, they have to know what to look for. So teaching the client, about cognitive distortions and about each individual cognitive distortion and the cognitive triad and, all of these things is going to allow the client to continue to use their coping skills in their everyday lives, even after their therapy experience has ended. And I think this is probably what makes CBT a very empowering form of therapy. I think therapy that allows the client to continue functioning at max capacity or close to max capacity after therapy has already ended is the mark of a good intervention, in my opinion. And then, of course, there is this practice and application piece. Like I said, clients are encouraged to practice new skills outside of therapy, but they're also able to be vulnerable and practice these skills within the therapy group. And that gives them sort of a safe space to try new things and to receive that constructive feedback from their therapist and from other group members. And this is really going to help them sharpen these skills and allow them to use them moving forward. So the therapist's role in all of this, in CBT in a group setting, I think is very similar to CBT in an individual setting, but there are some obvious differences. Of course, the main one being that the therapist needs to be cognizant of the group dynamics. And the therapist also has to be highly aware of multicultural diversity and social justice considerations, considering they are, facilitating a large group of diverse individuals. Of course, their job is to listen, teach, and I would say softly encourage, and that kind of goes back to the guided discovery principle of CBT. And because of this is going to make the leadership style of the therapist extremely democratic. So they kind of take on more of a facilitator role and allow the group members more freedom to direct these discussions and group topics. And I think this gives the clients some power in getting what they want out of their therapy experience and just kind of, making the most out of their group experience. And then speaking of multicultural and diversity considerations, CBT is kind of a tough pill to swallow when it comes to this because CBT's approach is very prescriptive and highly structured. So it doesn't necessarily cater to differing or, quote, non-typical backgrounds, worldviews, cultures, things like that. CBT was created by Westerners for Westerners. Obviously, it is hinged on very Western values, things like rationality and independence. I think personally, my biggest issue with CBT is this idea that it does not recognize larger systemic issues within marginalized communities. So, for example, when we look at the LGBTQ plus community, CBT can help an LGBTQ plus individual learn how to deal with everyday stressors because of homophobia or microaggressions or things like that. But I feel like this sort of erases the bigger issue, and it neglects that there is a larger systemic issue there. And I know that no therapy can address the larger systemic issue, but I almost feel like CBT kind of spins its wheels in that way because, you can tell somebody to change their thoughts about something. But if I, as a client, am coming to a therapist and saying, so-and-so said this homophobic thing to me, and then if my therapist was like, well, why don't we just change the way we're thinking about that? I'd be not super happy. So I think in many ways, CBT kind of struggles with things like that and working with marginalized populations. So then when we look at the strengths and weaknesses of CBT, a lot of this we have already discussed, so I'm just going to touch on what we didn't discuss. And that is this first bullet point in terms of strength. So the literature supports the effectiveness of CBT when treating mental health disorders like depression, anxiety, PTSD, OCD, eating disorders, things like that. Mental health conditions in which symptoms are exacerbated by harmful thought patterns. It is very good for issues like that. Where CBT is not so good is in treating things like psychotic disorders, so schizophrenia, for example, or really any other mental health condition that constitutes a separation from reality and rational thinking. I don't think it would work very well if you tried to treat someone who has a psychotic disorder by telling them to think more logically or by asking them to identify their cognitive distortions, because inherently their ailment or disorder prevents them from doing that. So moving right along here to Joe. So as the therapists, try to conceptualize Joe's issues, we have to recognize that it seems that his issues stem from cognitive distortions that he's engaging in. And I think we also really have to recognize that his negative view of therapy, as well as his belief that he cannot be helped, both of these are existing cognitive schemas that he has in his brain coming into therapy. So I think in order for therapy to work for Joe, we have to find a way to shift those schemas and those thoughts that he has. So as CBT suggests, our job is to help him recognize recognize negative thought patterns that he is having and sort of restructure them. So when we think about this in terms of a group setting, obviously it is a bit tricky because the first thing you need to be mindful of in any group setting is the safety of all the group members. In this current scenario, Joe is posing a safety issue for at least 2 other group members. So as a therapist, I think that is something that needs to be at the forefront of your mind all the time. You want to be able to confront Joe and help him recognize his irrational thought patterns, but you also want to be sure that you are maintaining the safety of the other group members. Perhaps one way to do this would be by calmly aiding Joe in walking through his sort of step-by-step thought processes and in helping him recognize how they are impacting the emotions that he's feeling as well as the behaviors that he's exhibiting within the group setting, especially the ones that are harmful to himself and other group members. So the technique going on here is obviously cognitive restructuring. And I think a really helpful way to do this so that your clients can kind of actually see it play out in front of them, something that I used to do with my clients when I worked as a youth peer supporter, was kind of like make a little chart. And we would start with the event, what happened. And then we would write down what thoughts did you have. And then we would write down how did you feel. And then we would write down what did you do. So this, progression of thoughts, emotions, behaviors. And then we would go back, same event, and then we would talk about, well, what if we switched the way that you thought about it? How does that then translate to differences in how you felt about it and how you behaved? And I think that can sometimes help people, because you're seeing it play out in front of you on a piece of paper. So I think that could be one way to approach this. Obviously, there are, I'm sure, many other ways to approach this. However, we are on a time constraint here, so we'll go with that one, and we wish the best for Joe. We hope that his issues get resolved. So, now we have our references. Thanks so much for watching and for listening, and that's all I have to say. Goodbye, everybody. Good night, good day, good whenever you're listening to this. Thank you.